Yeah.
Okay.
So the concept tonight is really something that sets up the stage for that, and we're really just trying to look deeper into a case study. We're going to start something from start to finish kind of thing, and just have some open conversation. It's a very simple pattern, and like usual, I want to start with a little green, you know, for my brother Chad. He always needs a little green. So, you know what was so cool is that, you know, I'm so into 10 Saturday, and I see. Okay, hold on. So I'm getting that reverb. There we go. Okay, it was Andy. Andy, I turned you off because I was getting a reverb on everything I was saying. Okay, so, you know, there was a time where, you know, we'll speak about Michael Thomas. Michael Thomas started talking to me about tensegrity, and Matt Hassey started talking to me about tensegrity, and you know, before you knew it, you know, here we are. And you know, I always used to just talk about tensegrity and stuff like, you know, it's this balloon and the body's expanding, but and I really see what it is now, you know, and how the human body operates. That's not the conversation. Well, conversation is, you know, we learn the anatomy, we learn the physiology of the body, we learn as chiropractors, we learn the spine and, you know, and the orientations of the facets and all these kind of things and so forth and so on that go to the spine. But there was a point where, and it's not long ago, you know, within the past year, that I realized that the whole human body, I said this at the last class, is every single thing in the human body, everything is there to do one thing. Okay, the heart, you know, you think the heart is kind of cool, it's there to beat so we can have life. Okay, but that's not what it's about, okay? The heart is to beat, the eyes, everything is there to support the experience, okay? Is the experience, and where do we input the experience? We input that from the nervous system, okay? So the nervous system is there, and the whole physical from the toes all the way up to the hair on your head is there to support that experience. And that's cool, man. I looked at like the heart as like, you know, it's just like an engine in a car, you know, it's there to, you know, with the top down, it's just to support the experience. It's a cool concept. The nervous system rules the roost, man, because it is the experience that we have through that and how our relationship with innate intelligence and universal intelligence, you know, how you guys see that, you know, personally. So we get to affect that. We get to affect that, and people that are doing QSM3 and wherever level you're at, we are the only ones that are looking at opening that experience. Okay, that I know. Okay, and chiropractic talk is nice, man. It's good. It's a great talk. Okay. All right. But we're going to have a small conversation of just looking at this. Just step back because, you know, pretty much everybody that's on here is, you know, that you guys are on every single time. Okay. It's like my story has become tiresome. But just look at this from the way that you used to look at this. Okay. If you can even do that, you know. I mean, you know, the first thing that you notice is, you know, look at the surgery down at the bottom, and then you say there's the curve. Just look at that, and what did you know? You know, what do you know? You go, wow, look at that curve. There's no curve. If I can make that bigger for you, you would see it's all broken down. Okay? There's a patient that started up with me about a week ago. Week and a half, maybe. So what do we know about this, man? You know, take a moment and just run through everything you know about this, okay? Not as a QSM3 chiropractor, but as a person that's been through multiple years of anatomy, physiology, chiropractic school, okay? And this is you know, this is our arena right here, okay? And our talk, okay, which is different than chiropractic or chiropractic talk, about this is, there's some, we look at the biomechanics and we see a bone out of place, and we call that biomechanics. We say that we change the nervous system, okay? We reduce the interference on the nervous system. We are nervous system experts. We are brainstem experts. We get a diplomate in neurology, and I can tell you everything and all the pathways and tell you all the anatomy and all the lines and all the train stations and what a neuron does and which ones turn sideways and everything else, okay? We can do that, okay? We can say, hey, you know what? We started with tone, man. We're about tone, okay? These statements that have, and we remove subluxation, okay? That's what we do. And that diminishes your life. So we have these slogans, structure, function, okay? The nervous system, tone, subluxation, and that's not my conversation, okay? My conversation is the conversation that integrates all those conversations, okay? And what we talk about in QSM3 is an expanded model. It's a model that integrates everything and looks at it in a live way, okay? Which is two things that chiropractic is not looking at, and it's not really about chiropractic because nobody else is doing it either, okay? There are people looking at motion. There are people looking at tensegrity, okay? But we're looking at the biomechanics of everything, and we have a purpose to do something, okay? What was our purpose before? The purpose when we were in chiropractic school, what was that purpose? I used to think the purpose was to, hear the pop, or to cavitate the bone, okay? Move the bone. That was my purpose, okay? And then when I got an upper cervical, my purpose was to create less tension on the foramen magnum and have the atlas sit nice and balanced and the lower angle sit nice and balanced and the head sit nice and balanced, okay? So that is my purpose still, okay? But my purpose is more than that, okay? That's just part of my purpose, okay? But we have goals as well, okay? We have goals of reducing the rotation in the human body that represent its compressive state and its non-energetic ability to hold itself upright, okay? We have a biomechanics model that our goal is to be able to reduce things to get on the vertical axis, okay, which is a Gregory concept, okay. And then the last piece is to watch the body take that configuration and change it because it's able to. Because when it's open and it's in a more tensegral up and open state, it's less jammed up. It's pretty simple, okay? And there is a measurability. I love that, man. I thought about that today. Measurability, man. That's what we That's what we do, okay? The first part of our chiropractic is the biomechanics and understanding what's going on, which is what we're going to talk about. And then the second part is our ability to actually make that happen. Okay, and to change that. So that's what I try to do every single day. I have a guy in the office that started, and he's got TN. And after it's been about 4 visits in 2.5 weeks, he's 50% better, but he's been no better, man, for a long time. So we can make some serious changes. And tonight we're going to look a little bit deeper into what we do so that we can understand more so we can take the next step. So, Biomechanics 101, okay? This is the picture of the night, okay? And if you look at it, this is the postural listing. And at a very linear level, okay, this when I ask what's going on a case in Facebook, this is the answer that I get this slide, okay? There's a low pelvis on the left. The fixed point is left. The weight is right 12. The shoulder is rotated on the right side 6 millimeters. The pelvis is rotated 2 millimeters anterior. And the shoulder, neck, and head are leaning to the left. That's what I get for a deep understanding, is a repetition of that posture listing. So tonight, I'm like, man, that's not enough. Okay, that's not enough for us, okay? So tonight, that's what we want to look at tonight, okay? And this is an easy misalignment, okay? This is probably one of the most common misalignments you will see. It's either number 1 or number 2 that you will see. Number 1 or number 2 is if the head or neck are right. That is the most common, along with this one. Okay? So it's important that we understand this misalignment and what to do with it, and also how it can propel us into seeing some other things. So nice and easy, right? What is this? Okay? Well, the 3 things that I tell my patients is what I look at is the building's tilting, okay? The configuration of the bricks, how it's zigzagging, and you look at that. If it tilts too far, it falls over. If the configuration is too, zigzagging all over the place, the first floor is over here, the second floor is over here, blah, 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 guess what happens? It becomes weak, and it collapses. And we can see that postural energetics, and we see that here. Okay, it's got some twist in the shoulder, and it's got a counter twist in the pelvis, okay? There is a postural section here, all right? So that holds this thing up, and that's the pelvis up to the shoulders. So the first 4 letters are really the look at posture. And what looks at putting the head right is looking for it. There we go. Is this stuff right here is what holds the body up. Okay, the head and neck don't hold the body up. This thing holds the body up. Okay, all the way down to the bottom there. Okay, that all holds the body up. Okay, this stuff up here. Do you see that? This stuff up here. I'm trying to see what you can see.
We can see it.
I'm highlighting here.
We can see it.
Okay, good. Okay, the head and neck are, if the body is not doing what it's supposed to be doing, those core postural section, okay, shoulders down, then the head and neck have to do something else to help so the eyes are on the horizon, okay? So in this misalignment, look at what's going on. Okay, there's 12 pounds on the right. Everything's on the left except the weight, and it's counter twisting. And you guys see this every single day. Okay. So biostructure 101, where is the stress in this thing? Where's the stress?
Left pelvis. And the compensation is not happening, so
I don't want to know about that. I just want to know the stress. Where does this person feel the pain?
I'd say on the right side of the body in general.
I want to know a spot where this person feels pain. Why don't you just stand up and put yourself in this position? Put everything to the left, okay? And then stick your butt out to the right and let the whole thing jackknife over.
Get a little back.
Like, you know what's so funny to me? Is that it's right there in surgery and nobody wants to say it. It's right here, okay? There's the stress. And if you see that, is what's happening in this misalignment is the whole thing is doing this, and the butt's over on this side. Can you see that? So here's your pelvis, here's your shoulders, here's your neck, and the head, all up here. Okay? And you can see that in this picture, but what you can't see is what the posture IQ shows you of the 12 pounds on the right. Because if you look at it, it looks like it's just kind of sitting up on top of itself, but that left low hip is swinging out to the right. Can you see that? Swinging out that way. Okay? Which puts a V where, my friends? Stand up and do that. Push your hip. Every one of you should stand up, man, unless you're in a car. Okay? Should stand up and push your butt out to the right. And as you push your butt out to the right, the left pelvis will drop down and everything will swing over to the left. That's this misalignment. Where do you feel it? Where's the V? Where's the stress?
Left side.
It's right in the middle of the back. It's between the pelvis and the spine. Okay? That's where the stress is. Okay? And you can see it. That's what that surgery is doing right there. Okay? Is securing that. All right? So that stress is, if you stand up and you feel that, okay, where you feel, where that V is where the stress is. Do you understand what I mean by the V? Or the misalignment? Does anybody not understand that? Am I on mute?
Yeah, the V is where the one part intersects with the other one.
Yeah, the V is where the stress is. I mean, you have a pelvis that's falling down, and right through the pelvis is all this stress as it swings right and everything falls down left. Just draw that picture. Draw that picture of how that looks, and you'll see. Okay, the legs are over here. Okay, you see that, and the whole body is moving upward. Okay, I don't know if you could see that in here. That kind of thing. So where's the tension? Tension is long. Where's the tension? Now you can pick a side.
Right side.
Yeah, the right side. The right side's in tension. The body's falling over to the left on the top, and the pelvis from below the pelvis is moving out to the right. So pelvis and below moving out the right, creating the right weight, and the 5 L's up there trying to compensate for that. You see it? No?
Yes.
Okay, good. All right, wonderful. So where's the compression?
Left side.
All along that left side. You got 5 lefts. Five lefts, certainly 5 shorts, compression on the left, okay? And what's the head say? What's the head telling us? The head is important, okay? Because it's going to tell us something down the road. We'll get to that, but it tells us today what? It says because it doesn't subluxate, okay, because it sits in that occipital condyle, okay, and it can rotate that C1, C0, C1, C2, atlas subluxation complex all up in there, that anatomy up there. The whole thing could just move and rotate. So the beauty of the head, of it falling over to the left, okay, is it's telling you what?
Something on the right side.
That's right. That's so simple, okay? So that's important because, okay, the head is a big and last neurology, and it can tell you, to me, right off the bat, it says that the right is a structural issue here, okay, because the head is helping me see that, okay? So we have a misalignment that the pelvis is translating left to right and giving us that right weight. We have the rest of the body above trying to compensate for that. And when you create that stress point where do you think you're going to have it? You're going to have it in the low back. And that's why she's bolted up. This lady is on 14 medications. 7 of them are for pain, and 6 or 7, I can't remember, are for her digestive system and her pancreas from what the pain meds have done to her. It's freaking nuts. These people do, man. Okay. So what's the collapsing motion? Is the thing is swinging out to the right, okay, and falling down on the left. Okay? So as the pelvis swings, it's taking, or the legs are swinging out, it's taking the pelvis is dropping down, and the spine and the shoulders, the neck, and the head are all trying to compensate for it. Okay? So in this postural misalignment, is there another V, or is there another stress point that you would like to tell me about? Do you see another break in the pattern? Is there a V between these 3? They're all left. If something is all left or all right, there's no V there. It's a line, right?
But Russell?
Yeah.
When you look at the X-ray, it looks like the VP would be on the right side.
I'm telling you what I found on the posture IQ.
I know. I just look at the same thing all the time.
Okay. So. Going from the posture listing, is there any other kind of kinks in the armor? And the answer is no. Okay. The answer is no. There isn't. Okay. Okay, so the $1 million question is, what's strong, what's weak, okay, and what's failing? All right. So what's strong? What's weak here? Let's start there. What's weak here? I feel like I'm torturing you guys.
The shoulder's not compensating.
Which shoulder?
The right shoulder is weak.
The right shoulder. Okay, so as this thing releases out to the right, the body bends to the left. Okay. So what's holding this off, Brad?
Left shoulder.
No, the right. What's holding
Brad, the right. Andy, I'm going to turn you off because I'm reverbing you. Okay, so
the right side is holding up the left.
That's right. So look, it's very simple, okay? You have a pelvis. Let's just draw the picture. Just stop looking at the X-ray for just a second. Use the posture listing. Okay. Oh, sorry about that. That's wrong. It's my eraser. Okay. I thought this was going to be so easy. It's like a simple misalignment. Okay, so here's the pelvis. Can you guys see that in yellow?
Yes.
Okay. And everything does this. Okay. So I'll tell you what, if you want to try to do this and get your weight to swing out to your right, your legs are going to do this. Do you see? Does everybody feel this misalignment? It's the picture I just drew. The pelvis swings out to the right, the left hip drops, at some point, okay, giving you the right weight. The legs are coming along with it, and everything above is trying to compensate. Okay? What is the right shoulder? What is this thing doing right here? That right shoulder is trying to hold up the world for that person. Yes?
Yes.
Yes.
Hmm?
Because this is falling down and swinging this way. Hence the arrow in the X-ray. That pelvis is swinging left to right, and that right shoulder is trying to hold everything up all the way through. Just put a pencil in that position. Put a pencil leaning to the left, it'll fall over. Put the legs leaning to the right, it will fall over. Okay? So this left QL over here, this left QL, that left TFL is weak and it's failing. It's moving outward. Okay? And that right shoulder is strong holding that up. What is an indicator that that right shoulder is doing a good job?
That the head is left.
Yes, Brad, you are a genius. Because the shoulder is holding the head. If the shoulder was unable to hold that and it would start falling more to the left, what would the head have to do? And the neck, maybe.
Go right.
Thank you. That is crucial importance for down the road to understanding these even deeper. Okay, so in this misalignment, it starts with some damage down into the pelvis that blew that thing left to right. Everything compensated above. Now I have a weakness in the left QL and the left glute, the left TFL, that whole lateral line, all those lateral guys over there trying to hold it up, and it starts swinging and falling and falling. Okay, and that right shoulder is doing everything it can, and that right TFL everything it can, and that right shoulder's having some difficulty right now. Okay, it's telling us. How do I know? Because there's a counter twist, and it's a 6, so it's starting to show some trouble. Is that fair to see that? It's so easy to see all this stuff. Okay, you see the numbers, you see the pattern, you see the motion of it. You see where it started. You see where the V is. You see what's weak. You see what's holding it up. I have a patient today. She says, my right shoulder is really sore. I said, well, you better be nice to that because that's the only thing holding you up right now. The idea is to get that so it doesn't bother you, okay, which means we change the misalignment and lift it up, okay? But we have to understand some of these muscle tensions become our friend because why? Because there's damage, okay? And we're not just some massage therapist or some therapist that just starts jacking on the muscles. That's not what we do as chiropractors. As QSM3 chiropractors, we want to create a, integration between the osseous system and the fascial system, okay, and try to find a sustainable place. And it starts by looking at all that information from the posture IQ, all of it. You can't get that information from the X-ray. The only thing I really get from the X-ray is how bad it really is on the inside. You see like the little localized kinks, and I like checking a pelvis on, double checking a pelvis on an X-ray. Otherwise, it's strictly patient education. But I could look at that and I could see the motion, the breakdown, the weaknesses, the possible weaknesses. I see the strengths of it. Okay, that low back is hanging in there. Okay, it should be. It's all metal. Right? Okay, beautiful. Any questions? Okay. So we've got some structural stuff, structure on the bottom, neurologic stuff on the top. It's just the way we're made. Okay. And if you feel this thing, you see those legs swinging out, those femurs swinging out, and everything dropping off to the left. So the neurology is the thing when we release that, okay? We do the neurology side up first for two. I do it for two reasons, okay? I do it, number one, because it's the thing that creates the curl, okay? It creates the curl, okay? Because the structure falls off and neurology bends it back. So it creates the curl. So it usually is the factor that clears the rotations, okay? Because curling, bending, is compressing, okay, on one side. All right. So that's one reason. The second reason is the more important reason for me is that the neurology has to be stronger than the trauma overall. Otherwise, we can't stand up. We fall down. So we have to overcome that neurologic lock first. And it's a lot easier to deal with that directly on the side that's up. So we start on that side, okay? And it works that way, okay? There's going to be an exception to that, man. I figured out a way to, I found patterns that need one side. Well, that's where we're going after this webinar. And at Mod 3, that's what we're going to go for, okay, as well as the adjustment. But the neurology becomes that whole left side. The structure becomes that right lower femur, that lower section of the legs, okay? And you could see it, and that makes the release sequence a left-right. Now, if you just look at it and feel it, okay, if you stood up and you did that, you'll notice that's exactly what you would do too. You would say, man, I'm going to lift that guy up, okay? So sometimes when you adjust this person, they open when you release it on the left. Sometimes they collapse. Sometimes the weight gets bigger and it opens. Sometimes the weight gets bigger and it collapses. Sometimes the weight gets smaller and it opens. Sometimes the weight gets smaller and it collapses. So we're going to look at those things, okay, and try to understand what they mean more than just, well, we better do the other side, which is a good answer, by the way. But try to understand it as another answer. So is there any questions?
I have a question. Can we use that? So when I just did that, mimic that posture, there's no way I'm going on the right side. So you use that all the time? It seems like another way to help figure out where you want to start.
In this misalignment, you probably don't have to go on the right side. You know?
What I was asking is that seems an obvious way another way to confirm that it's correct if you're unsure, is to put yourself in the position there's no way I'd start on the right side, because that would collapse them further.
Well, maybe.
Okay.
You know, maybe. You know, that is true if everything was linear. Okay?
Okay.
You know, I mean, that's what I say to patients in my initial consultation. I said, what we have is a picture of a misalignment, and then we have your energetic quotient. What I'm going to find out over the next 3 visits is how much misalignment I can release and how much of your energetic quotient can hang on to it. I don't know that answer, and I can't tell you what you need until I know that. Okay?
Mm-hmm.
So, Brad, anything goes, buddy. Okay, anything goes.
Okay. Yep.
Otherwise, we'd be doing another technique. But the human body is not linear. It's quantum. Figure that. It's quantum, man. It's got a life force. And there is damage, there's weakness, and there's weakness that the body can hold on to. And it does that over time. That's called health, right? So what we have today is different when we have tomorrow. I tell every single person, I adjust them where they are today. Okay? And I like to see a pattern over time, and I like to see things that work and things that don't work. And then I know when they don't work, why, and I want to know when they do work, why. Okay, so here's a couple little posts. So it's after the left release only. That's the listing on the top. Okay. And so one of these listings happened. This is the real thing here. Okay. So what happened in number? Let's take a look at them. Okay. Just take a look at them. So I don't want to talk about why something happened. I want to know just what happened right now, and then what am I going to do? So first of all, in number one, anybody want to tell me what happened? It's your favorite thing to do. All you got to do is tell me what you read. What happened? Brad, you're an expert at what happened. Tell me.
The weight increased.
Thank you.
The rotation increased. The end.
Excellent. Great. Okay, great. So is that good?
No.
Okay. So what would we do?
Go to the other side.
Very good. Excellent. Beautiful. Okay, what about B? Brad, tell me what happened.
The weight increased. Rotation increased. Look at me. Look at this. The same thing. P12, P9. Oh, I'm sorry. The rotation, they went coplanar.
Okay. So what do we do next?
I'm still going to, based on the weight increasing, and I'm still going to, well, yeah, I'm still going to go right side.
Okay, great. I would too. Okay, right. We'll talk about each one of these in just a minute. Okay, so C, what do we got there?
You want to let somebody else do it?
No, you. You're the captain of what's
the
there.
weight decreased. The rotation went coplanar, and the rotation decreased. So that's good.
Yeah, that's good, right? Yeah.
I like
so what
that.
do you do next?
Well, that's a good question.
Okay, well, you're the doctor.
Yeah, I may stay with that for another time.
Okay, fair enough. Okay, what about D?
The weight decreased. The rotation stayed non-coplanar. One increased a little bit. So on that one, I'm probably going to go right side.
Very nice. That's perfect. Good job. Okay, nice work. Okay. All right. So let's talk about just a little bit deeper what's happening here. So in the first one, post A, the weight increased. I'm on the left side. Would it be fair to say in this misalignment that it's, can you guys see this? I mean, if I just draw this V like this, can you see that up there?
Yes.
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 Okay. So when I adjust this on the left side, you see that arrow I just put up. It's a very good possibility that I get this, right? Which is what? Linear, yes? And
Yes.
I could see the weight increase. Yes, I could, right?
Yes.
Okay, good. I just want you to know that that can happen. Okay, and there's a decision that you have to make at that point to walk them around, rest them, okay, and then make a decision what you should do, okay. And it's a case by case conversation, but we're going to have a little bit of that conversation tonight, okay. So what happened first here is the weight increased, which is possibly okay, all right, an expectation that I could see, okay. But the rotation didn't. It fell down, okay. Okay, so it collapsed. Is what happened to the motion of this thing? Okay, I mean, look at the picture up there, the one with the arrow and the one that's not the arrow. Okay, what happened to this one? What picture represents it better? The first picture or the second picture?
Second picture.
Okay, let me ask you another question. Let me ask it another way. Which one of those pictures would you think is open, and which one would you think is collapsed?
The linear one is open.
Thank you. Of course it is. The definition of twist and rotation is it's collapse. If something is bending or something is leaning, okay, I mean, it's a no-brainer, okay? So, which picture, I'm going to ask you again now, did this become more open or more collapsed?
More collapse.
Okay, so which picture does it represent?
The one with the arrow.
Thank you. So what happened in this picture is this whole freaking thing just fell over in that thing. It took a V. It's like you have a V and you just pushed it over and the whole thing just fell over as a V. Do you see that? It collapses more and the weight gets bigger because the butt just keeps moving over to the right. Do you see that? Yes? No? Can you see that?
Yes.
Okay, so if that's happening, okay, then where is it super weak? It's super weak where? Where is it just can't handle that adjustment?
Left side.
Left side pelvis. It's just falling right over, okay? See, for this thing to become linear here, guys, this left side, if for this thing to open, this V to become here, this V, you know, I'm going over here to post A here. This V, okay, as it goes out like this left side has to be able to hold on to that, okay? It's got to be able to do that. It's got to be able to open, okay? And if it can't open, okay, because this thing is just falling over because you gave it one little shove and it doesn't even get a chance to lift up and out, the whole, the chair just falls over, then, it's no go. Okay, and that's what's happening here. Okay? So that's why you have to turn this person over. Okay? Because the neurology is not the primary issue. Okay? The primary issue here is the structure is collapsing. Okay? And it needs help for you to get on that right side and lift it up. Okay? Can you see that? I mean, that is a very deep conversation of why something is happening, not it's just collapsing. Because if you could look at this misalignment and see that the whole buckle just fell over and fell down more, okay? It went more right and more down, okay? So, instead of, this is a good example. Instead of this and this, it's this. Right? It fell over more and fell down. Okay, so here's the legs, on this bottom part. Okay, and it's fallen down further. I think do you guys see that? And that's what that picture represents. Somebody say yes.
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 Thank you. Okay, good. Okay, so that is why you have to get on that right side and you have to boost this pelvis up. Okay, because this thing is weak and it needs you on that right side to open that short tension first, okay, which is the legs. Okay, and that doesn't mean that you go left next time. Okay, I don't know that you should do that. I'm not sure of that answer. Okay, of just, well, let's just go on the right for the time being. You may want to try that and see how they respond. But at some level, you're going to have to open the neurology. But that right side is so weak in post-A, you got to just get that guy up first, upright, because you can't even open the top. The whole thing just falls over. Okay? So that left TFL, that left Q, that whole left side is weak. So you want to give some patient homework. You better teach them how to activate those left muscles of the left TFL, the left piriformis, the left QL, the glute medius, whatever those lateral guys. Sean knows, I don't know. Okay, but that left side's definitely weak. Okay. What else are you going to do with them? You want them to stretch things. So you're going to see where things are in compression on that misalignment and say, hey, you know? So you can have the person with their pelvis down on the left, okay? What is going to activate it so it brings it up is giving them, exercises to take their pelvis and shift it from right to left and then bring it back to center, right to left, okay? And so giving people motion for the neurology and resetting and giving people stuff for the stretching, okay, of the pelvis. Don't give them stuff for stretching above the pelvis. I found it to be a problem. We're going to change that in our office. Okay? There's two sides to the pelvis. One side short, one side long. Okay? Just go wiggle your pelvis around. You'll see what muscles you'll need, which are the lateral guys, which is short, which is weak, and start looking into that. And then I'll chime in Mod 3 or at the next conference with something very specific. Okay, because it's important for the fascia to get some treatment that way. Okay? All right. Post B. I'm way behind schedule. Post B. What's happening? Come on, somebody take this from me. You know the worst thing that can happen is you try.
All right.
Thank you.
It's still collapsing, but at least we are coplanar now. So it's able to. It's in better shape than A. It's able to hold up a little bit better, but it's a similar situation.
Okay, so what is it doing here? What is it doing?
It's
opening up,
going off to the right.
Okay, yeah, it's going off to the right. And what's the rotation doing? Is it collapsing or is it opening?
opening.
It is opening. Okay, so that tells you something about the left release. Do you need the left release?
Oh, show.
Yes. Yes, because it's partially opening. It became coplanar. I see that it fell down, okay? But some of the way out, for me, at least in this one, is a possibility, okay? Is, because that's a positive sign. A positive sign is what I want to see. And I saw non-coplanar go to coplanar. Yeah, it got bigger, but it's still a positive sign. There's negative sides too about it. I got it, okay? But one of the positive signs, and that to me tells me that I wouldn't even consider not adjusting this person on the left in the future because they need part of that, okay? And then I would flip them over on the right for the other reason of A. Okay? Because the pelvis and blah, blah, the left side is weak and the whole thing just fell over like weak table legs and you push on it and the whole thing just goes sideways. That's exactly what the increase in weight did. Okay? Number one fell down. Number two started coming up a little bit. Okay? So they both need the right side. And B definitely looks like it's using some left side as a positive piece. I think that's cool as crap, man. I love that.
Are you concerned? Are you looking specifically at what the pelvis did versus the shoulder? Or
no, I'm just looking at I'm a global dude, man.
okay.
Okay, I want to see things open, and I want Nate to tell me it's way out. Okay, so this is telling me that it needs to go out to the right some. Okay, I mean the weight can increase. Okay, the weight could increase, and the whole thing can reduce to 0 in the rotations, right? So it could tell you that's the way out. That's what you want to see. You want to see the way out. Okay? That's that picture of the ice that I have, where the hole in the ice. You fall through the hole in the ice and there's a current. You have to find the path back to the hole out. Okay? This is telling me in A, that's not the way out right now. Okay? In B, it told me that the left release is a partial way. It's moving towards the way out. Okay? Okay, C. What happened in C? Anybody want to take it over?
We went coplanar.
It's open.
Okay, is it good? Okay, is it good?
Is it good? Yeah. I mean, the pelvis rotation went higher, but at least it's coplanar.
Mm-hmm.
I mean, the weight reduced some.
Mm-hmm.
So I think,
Okay, so we did this on, Bartosz, we did that on the last slide. I appreciate of what happened.
yeah.
Okay, I want to know what happened, man. Now.
C is where you want them to be.
C, you know, I'm happy. I like C, obviously.
Yeah.
I mean, and I'm not doing A, B, C, D. I stopped at C. Okay.
You went more linear.
Yeah, man. The thing is going towards 0, and it became coplanar. It told me that the pelvis liked the left side release, okay, and it opened it, and I didn't want to mess with it. Okay? Now you can go ahead and mess with that. That's okay. I could mess with that, but I mean, I chose not to. Okay? Any questions?
Is that the one that happened?
So I'll tell you what happened in just a moment.
Okay.
Okay, so what happened in D?
Collapsed slightly. I guess so the V increased ever so slightly, but
Yeah, so what do you think happened with this thing, man? You know, the weight shifted, man, and nothing else really shifted.
yeah.
It's like a lateral move, you know? It's not an up and down move, it's a lateral move.
Yeah, I mean, not too much happened, other than the weight came down. You know.
Well, I don't know. I think something happened. I mean, I can make something up. I'd like to at least talk about something. I didn't put it up because I want to talk about it.
Yeah.
That'd be... Okay, so
Well, the rotation increased, therefore it had a semi-collapse in there. It tightened up more.
maybe, but that's too...
Is it too small amount
Okay.
to really make that determination?
Yes. Andy, I had to shut you down because I'm reverbing every time I talk. So to me, this is like one of those pieces where you'll see like a configuration change where something was stuck, okay, sideways, and it wasn't integrated, or something was bending, okay. I mean, I don't know, and it's can bring you a new pattern. I mean, that's the only thing that I could see with this is, I mean, because if I get somebody up, I had to change something, okay. So I generally wouldn't see this, but I do see this with, you know, sectional changes. Like I'll see the head is different from that because something was stuck in there rather than something that was degenerated. Okay. All right. So the first one kind of just fell apart. To me, it tells you where the primary is. Where C, excuse me, is just the opposite of that. Okay, because I only adjusted this person on the left in C, and it really reduced nicely, okay, it's telling me that most of this is responsible neurologically, and I can open it on the left and I can get the whole thing, okay, which is nice, okay, because I prefer to adjust somebody on one side if I can, all right. Now, that doesn't mean that I don't turn this person over in the future. I don't know the answer to that. I'm just trying to look into these things. But A definitely tells me I got lower than pelvis problems because the whole thing just fell over, okay? B tells me, you know, I got low pelvis problems, but I was able to lift up some of that neurology, okay, and get that to twist out a bit, all right? C tells me everything's moving in a great direction, okay? And you could choose to either go back on that side or whatever you choose to do. D tells me that, you know, I don't know, man. Hopefully I don't see D because that would be a little frustrating for me because not much is either there or just a sectional piece came out. Okay. So that is the beginning conversation, or another part of a conversation of understanding more of the structural and functional dynamics of the body and the energetics of them, where those kinks are and how the body's expressing itself. And this misalignment here represents something very differently. Okay? It tells you other things that are happening. Okay? And what this will then lead into is where number one has only one structure-function relationship. Okay? The second one doesn't. The blue one does not. It has two. It has two structural issues and two neurologic issues. And there are misalignments that have three. And we'll be able to start looking into those and seeing how we can set them up, understanding structure and function, which we do now, and with the algorithm that I gave you is based on one misalignment. Okay, but the second one has two. And I'm able to differentiate the one here that gets one side and the other one gets two sides. So you can look at that and you could see how that's going to pan out for yourself and see how that mentally works for you, okay? So that's my slide for the night is, shall I seek to measure these differences, Master? I love that. And the answer is yes. So what happened in this person is I adjusted them on the left and B happened. Okay? And then I flipped them over on the right and C happened. Okay, and that's where I stopped. That's why I said that's why I stopped there. But I went to B first. It was cool because the husband is a pilot. And he was watching from behind the Postural IQ. After I adjusted, I said everything. He said, wow, man, that weight got much bigger. I said, yeah, but the rotation became coplanar. I said, now I'm going to adjust her on the right, and the whole thing's going to open up to center. And it went to 6, 2, and 5. And I looked at him, and he had his eyebrows lifted up. Okay? And they paid for all care on the third visit, one shot. And she felt better after the third adjustment right there. So that's the first time. So the first 2 visits, she didn't feel better. Okay.
What'd you do when she came back?
I don't remember what I did. I can't tell you that answer.
Depending on what showed up.
But she needs to be. I could adjust. This is a tough call. I may be able to get everything on the right side with this one. But we'll talk about that. But that's what happened is the rotation, and I said to him, yeah, but the rotation became coplanar.
Is that after you adjust the right or the left?
After I adjusted the left side, B happened.
Oh, I thought post A was with the left side, and then you went to the right, and that's post B. I got that wrong.
No. Post A, B, C, and D this is only after the left side here. Okay, when we were having a conversation before, all of these were just a discussion of after the left side. What happened in real is when I adjusted her on the left side, the post was B, Matt.
Oh, okay.
It was B. Okay?
Changing my notes.
And then what happened is I flipped her over, and the post became C. Okay?
Okay.
So the left release gave me B, and then I turned them over, and the post C was what I got on the right. So I adjusted her left-right. Okay? And I saw the rotations reduce from the right release and the weight reduce, and I was out of there. Okay?
Mm-hmm.
Okay. Any questions? So, you look at your postures, man. Start looking at the way these things in motion are broken down. And structure, function, structure, function, structure, function. You have structure and function. If the function then starts breaking down, then the function above has to compensate for that structural breakdown. All right. And when you put that all together, we are going to be able to take a relationship of these things and figure out the best algorithm to release them from either one or two places based on these misalignment patterns. Okay? And you can look at them at just their numbers. You can look at them further as where it is in tension, that is in compression, the tilt, the weight, the rotations. You can say, hey, where is this thing failing? Where is this thing strong? Where is this thing trying to hold it up? Okay? Like we saw that shoulder was strong, but we saw that 6 in that rotation was starting to stress it. So you can look at all those things and you can have a nice conversation with yourselves and your patients. And then when you make the changes and you're able to record them, you see the outcomes of your work. And then the outcomes become a driving purpose for you to reach different goals. Okay? So you need to be able to measure. Okay? So I have one posture IQ ready to go for anybody. Give me a call if you need one. Okay? Which is about 4 of you on this call. Okay. All right, man. Hope everybody has a nice night. Any questions? Final questions? Okay. Hope you enjoyed it tonight.
Yeah, thanks,
Have a
Russell.
nice night.
Thanks, Russell.
Thanks, guys.